So we know that repetitive and untreated pain is detrimental to infants' growth and development. However, we still don't have enough evidence on the effects of sucrose given repetitively in terms of neurodevelopment. We do have a few studies which demonstrated that the repetitive use of sucrose during the neonatal period did not result in developmental delay. However, we still don't know if sucrose is able to protect or mitigate any adverse effects related to pain and its consequences in early stages of life. So I think, again, it's important to have local protocols and guidelines and use sucrose as a medication, document it properly, and have all the registration and all the reasons to administer sucrose as a medication. There are a lot of barriers and challenges to implementing new practice or to change what we do, especially if we are doing things for quite a long time. And I think for sucrose in particular, some of the barriers might be that sucrose is not always readily available at the bedside or at the unit. And without that, professionals just don't take the time to order, to wait for that, and to use it. So having it readily available, having protocols, having unit guidelines which help clinicians to improve the use of sucrose would be something to have in mind. Other issue is that we as clinicians, we are always in a fast-paced environment, and we want to complete all the procedures, all the care as much and as fast as we can. And the realization that pain in infants is detrimental is not something that we do on a day-to-day basis. We always think, oh, I'm just giving this baby a quick poke and it will be over soon. So it doesn't really need any analgesics. And that's really the opposite, right? Because every day we think that, and every day we account for a couple of procedures for this baby in their first days of weeks of life. So it in the end, it accounts for lots of pain stimuli, lots of stress, and it's important to change practices and to think about ways of preventing pain. I think also having structured ways of documenting and administering sucrose through workflow and resources locally implemented in the units, it's important and it would help uptake of these new practices and having some professionals who could be agents of change, who could be champions to really foster education, introduction of evidence-based care, engaging parents in learning more about pain and how they can contribute as well for pain care would be options that we could implement locally to improve the use of sucrose and other analgesic strategies for procedural pain in babies. It's always important to consider that painful procedures are painful, right? So preventing and trying to minimize pain while preparing babies for these procedures is crucial. And all of these procedures should be considered painful and should be accompanied by different types of interventions. We publish this review, we publish other reviews, and that are out there many, as I said, clinical practice guidelines and protocols displaying different interventions that are effective, that are safe, and that should be used, but they also should be individualized for the infants, for their for their clinical status, for their gestational age, and for their family preferences and readiness. So I think clinicians should know about all these strategies, should know about the evidence-based effectiveness of these strategies, and should follow these protocols when selecting these interventions, when applying these interventions, and when engaging families to help with preventing and ameliorating procedural pain in infants. I think we always I think the biggest problem with infants is that we don't have a gold standard pain assessment measure for babies. And so we need to rely on the clinician's observation and the clinician's knowledge to identify pain signs and to use some of the pain assessment measures that we have published and that we can use for measuring pain intensity in babies. But I think most importantly is really to acknowledge that babies do feel pain. If a procedure is painful for an older child or for an adult, it should be as painful and should be treated even before the baby demonstrates any signs of pain. So, when it comes to procedural pain in neonates and infants, it's really important to implement these preventive measures of these preventive interventions so we can really prevent and minimize pain and avoid any long term consequences of pain in early life and in adulthood, even.